criteria determine whether the procedure is high risk or low risk category. When huge money is involved, it becomes automatically a high risk situation. If the patient is paying 2,000 or 1,000 to get a filling and the patient gets some trouble in the filling, it's not a big issue. It won't go to bigger level. But if the patient is paying in lakhs, 3 lakhs, 4 lakhs, 5 lakhs for full mouth rehabilitation, then definitely patient expectations is high and our commitment is also big. This is first factor. What is the financial aspect involved in that? Okay. Second is how big the procedure. Full mouth rehabilitation is definitely a extreme big procedure only. It is like demolishing the entire house and building a new house, or you are constructing a new house where there is no building. So because of these two reasons, it becomes a huge risky procedure. The patient expectations is more, our commitment is more. So whenever you are doing consultation or doing surgery or doing prosthetic work or even phone communication reception, you have to understand this. It is not some 2,000 rupees issue. So patient is paying big money and big procedure, definitely the risk is also more. So there are certain kind of conditions and patients we should not treat. If you do that, you can reduce all the headaches and problems in your clinic, 99%. Okay. So what are all the situations we should avoid? If you know how to filter and avoid this patient, it will be an easy journey. Okay. Initially in the practice, the doctor's mindset will be to treat all the patients walking into the clinic. You should not have that mindset. If 100 patients are coming, you should not try to do treatment for all the other patients. Our mindset should not be like that. So when you are doing consultation, the mindset should not be trying to convince the patient. You should not convince the patient. I am repeatedly telling you for many years. Our job is not to convince the patient. Our job is to educate the patient. Educate about that problem. Educate about what will happen if he doesn't get treatment. What will happen if he gets treatment? What kind of treatment options are available? What you will expect in each and every treatment option? What are the pros and cons of each and every treatment option? What are the financial aspects? How many days, how many visits tentatively needed? Educating the patient about this is the only duty. Not even 1%, you should keep in mind that I have to convince this patient, I have to convert this patient, I have to do treatment for this patient. You have to educate the patient, but that education part you have to do properly. Okay. So there is a way to educate do's and don'ts, that you have to do it properly. So what kind of, so I always tell, consultation is a elimination process first. Consultation is a primarily elimination process where you are deciding whether you are going to treat this patient or not. The same way the patient has the right and the freedom to choose his doctor. The doctor and the institution also has the 100% right to choose that patient. They have the right to say no or yes to patient. Okay, not only the patient chooses the doctor also chooses the patient. So first kind of patients, the rude, psychopathic persons you can see. Not all 100 people, we see every day they are good, good vibe, positive, no. Some patients are extremely negative, spreading. They don't give respect. They are rude to the reception staff. They are rude to the doctors, the non-dentals. You should not do any kind of treatment to them. Better you refer them to some other centers. Okay. Second patient is patients who are heavily bargaining. They think it's similar to some kind of fish market or brinjal shop. Heavy bargaining. See, when the patient asks for some help, I want to do this, but financially I am difficult. Can you do some kind of help? If they ask like that, if they ask help, that is different. But bargaining is different. Some patient will tell, I know how much cost is involved. Do within this amount. I went to there. They are doing at this rate. You can do doctor. They will do. So if you treat such kind of patients, then it will be a headache. If something goes wrong, if some kind of problems come, then they will tell you have reduced the quality, you have used reduced quality materials, you have compromised treatment you have given. They will accuse you of that. Okay. So during ICD, during initial consultation, you should have that skill to filter these things. Even during initial phase, you should know. Okay. Third thing is, there is many patients. Your doubt is, some patients, no, Sandhya doctor doubt is, some patients they don't have much mobility. But when you see CBCT, there is extensive bone loss. They might have come for only front teeth implant or some one shake tooth, but it is actually ideally a full mouth rehabilitation. If you tell suddenly full mouth rehabilitation, they cannot accept it because they came for thinking something else in mind. Just I will fix this two teeth or this small gap or lower anterior. But when you tell it is a full mouth, they cannot accept it. I tell Anjali, tell the patient that do not take any decision today because you have come for some small problem, but we are telling some big problem and big treatment. Do not, even if you are willing to do treatment, we won't do treatment today. Go and get 2 or 3 opinions. We will give you the clinical photos and x-rays. Take time, 2 weeks, 1 month time you take, then you decide. But this is the correct time. If you want us to only these 2 teeth and place 2 implants, no, that is not a correct plan, that we are not doing. Okay. If somehow the patient is okay and gets treatment on the same day, you imagine this kind of patients, then within few days they will accuse you that you brainwashed them and you did some treatment, you removed all my healthy tooth. They will accuse you like that. So they have to meet 2 or 3 or 4 or 5 doctors. They have to get multiple opinions. They have to understand their own condition. So give time, don't rush. Okay. Yesterday patient, yes. He came for only 2 teeth, but see composite smile design. And the final category is very important. If the situation is is beyond your skill set, beyond your limit, don't treat the patient. Okay. Yesterday one patient came from the patient is taking medicines for BP, calcium channel blockers, severe gingival hyperplasia. The patient is taking Conparag, he is having reduced mouth opening, right? Only 12 mm or 14 mm. Patient is having cardiac issues also. So the primary problem is the OSMF, oral submucous fibrosis. The patient cannot open the mouth. So we have to first treat the oral submucous fibrosis. The patient is also having a cardiac problem and gingival hyperplasia and severe bleeding. We refer to the patient. We refer to the patient to a surgical center where they are doing OSMF daily, where they are treating oral submucous fibrosis daily. It is better, they can handle that better way than us. So if you feel that this is beyond my skill set, do not touch. You have 2 options. You can refer them to some other center, or you can call somebody who is good enough. You can call to your clinic and do it. But that option is also not good. If you call somebody and you do term patient, if some problem comes and if the doctor doesn't respond, he doesn't know how to manage that complication, then you are only responsible. So calling a consultant and doing some high skilled procedure is also not a good idea. If some trouble comes, he will run away, right? He won't pick the phone. Then you are answerable to the patient. So the better decision is to take your prescription and write a neat letter. Herewith referring this patient with so and so complaint, kindly do the needful. That's it. Put full stop. Okay. If you follow this protocol, 99% is over. One more important thing, the final thing is that we are facing unrealistic expectations. There are expectations, high, which is very high, especially the prosthetic part. Some patients will demand, I want single tooth, not bridge. which is not possible, theoretically, practically. That kind of patient, you should not take. Or the patient is showing, some picture of, some heroine or model, or even our old patient photos. Doctor, I have seen on the website that pre-op post-op is good. Can you do the same for me? That smile is apt for that face. Their face may be, more beautiful, more. One patient was repeatedly showing one more portion photo. I expected that this would be. For that, no, she should become like that patient. So when the patient is showing some other model photo or some other screenshot from Google, I want teeth like this, then you should be more approach cautiously. Aesthetically, this is the challenge. Practically, this is the challenge. If you feel that the patient is having unrealistic, that is what doing consultation, not only the surgical part, the process is how it will look like, how much thick it will go. Palatally, it will be thick for you. Lingually, it will be thick. The gum color will be like that. Gum color will come. Some patients, they don't want gum aspect. They want only the tooth. But they may be FP3, they have severe resorption, they might have lost all kind of bone. We cannot give only the teeth. Yet is it possible? So you have to show all kind of photos, prosthetic photos. Preferably models is better. That is what we discussed in the last discussion. Better show all kind of FP1, FP2, FP3. Palatally thick, palatally not thick, with gum color, without gum color, different gum color. This is how it will be. We don't have models now, at least you can show, we have a lot of photos. She is showing all kind of photos. She is showing even the gap also. After 1 or 2 months, when the gum shrinkage, you will see gaps like this, but that is quite good.
Yesterday patient, we were not able to place steroid implant process. So the patient, when I was informing the patient that unable to place the implant because the bone quality is very soft. So no need to place the implant, we can support it with ready-made. The first question patient asked was, wait a minute, how much should I pay for the implants? How many implants are there in my mouth? I want to know how much I paid for the implants. That situation. So he's not worried about how we are going to give the teeth, what is the next procedure, so how are you going to deal, doctor? The only question he asked was, how much did we pay for the implants? How many implants are there in your mouth? This question is asked.
See, we are placing extra pterygoid. Actually, we should have charged before, no? We are placing extra pterygoid. So how you handle the situation?
I was very particular in my point. We cannot place implant and land you in further trouble. So better we don't place the implant and we extend the wire and give you. That is why they said there is a good bone. We can place implant. That is why my bridge broke. Your bridge broke because of no support, but now we are going to manage it properly. So we are going to extend the wire. We are going to build the wire like a wall and then give you the bridge. We will increase the thickness of the bridge, it will not break. That patient was
especially on the financial aspect.
Financial aspect.
Right? Last 2 weeks back, one patient, we placed implant. After placing the implant, before taking it, the first question patient asked, with the numbness, everything, how many implants? Yes. When I told it, okay. Some patients, they expect more number of implants to be placed. Some patients, very rarely patient expect less number of implants.
But I told him very clearly, cost is not based on the number of implants.
So it is a package. Yeah, it is a package. Number of implant doesn't determine the cost. It is the procedure involved, it is the prosthetic aspect involved, right? Laboratory steps involved. Patient will focus only on the implant number. Okay, this much number of implant, this is that's not right.